over.
So, Gary.
Yes.
Gary is back from, well, he had the MRI yesterday,
Yep.
didn't you? And we've put up an update 2
Yeah.
about the MRI, but we're going to chat a bit more about that. But this morning, so you've been busy. So this morning, Gary had his pre-admission clinic, which is where they check you over before you go in for the surgery, which is booked next week.
Next Wednesday.
So what was the pre-admission clinic like?
Yeah, it was pretty good, but
Yep.
I had to, first I seen the nurse and then the doctor and then the pharmacist, which I was surprised, I had to go through all them things. And so it was a lot more than, because I thought, what are they going to do? Like, check me blood pressure and that, but...
Yeah, I thought they were just going to check blood pressure and...
No, they put me on a monitor with, all them stick-on magnets all over.
So talk us through it. So who did you see first? You went in...
First of all, I seen the nurse.
Nurse, yeah.
And
what did
she
do?
just documents all your paperwork and everything onto the computer.
Yeah.
Make sure you got the right person, everything. And any diseases, allergies, any sickness you've got, she does that. So then that obviously gets passed on to the doctor. So the doctor was the second one.
Yeah.
And then she just goes through the similar process, but just a bit more medical side of it to make sure that I've got no diseases and things that could stop you from having the operation. So,
Was she the anaesthetist?
no.
Or a doctor?
No, just a doctor.
And so did they check blood pressure?
Yep.
And what did they put on your chest?
Yeah, I'm not sure exactly. I should have asked her that. I didn't. It was like a monitor machine where she just stuck the sticky pads all over your chest, and then you could see the readings, like your heart going across. There was about 6 lines, and she just, that's all good. So everything was working anyway. So that was all right. And then went and seen the doctor. Not for very long, just for 5 minutes or so. And she just went over things and to make sure that I know what's happening, what you're actually getting done to you, and you understand the operation and stuff, so that you're not left in the dark when you turn up and sort of, I didn't know this was happening. Whoop. So
what was she saying though? Like what is going to happen then?
Oh, the surgery is to the main surgery is to go in and remove the tumour from the kidney.
Kidney, yep.
Yeah. So
So is it in your kidney or bladder?
Sorry, you're right. It's my bladder.
Bladder, yep.
Bladder,
yep. I mean, very similar organs. I think they're sort of around. I think. Are they? No, actually, they're not. I don't think so.
No, but it is in the bladder.
Yeah, bladder. Yep.
And so they go in and remove, hopefully, all of it.
Yep.
But they can't go too hard because they don't want to make the bladder wall start bleeding and stuff and cause more trouble.
Yep.
But they're better off just taking some of it until they get it tested, and if it's not cancerous.
Yeah.
What is it?
Benign.
Benign. That's it.
Yeah.
If it's benign, well then they'll leave it. But
Yeah.
if it was cancerous, then they'll take it further and either go back in, cut it out, or you go on treatment to do something about it. So,
minimise it. Yeah. Yep. And then, but you're also getting your prostate biopsied as well.
Yeah. Getting both barrels on Wednesday. So that's a similar. Just go in and then take some. I think it's like just injecting needles into your prostate just to get samples. Yeah. Just to. Yeah,
so they're not removing anything from your prostate.
No, because at this stage they're not sure whether there's anything really major wrong with it. And the MRI yesterday will give them more detail, which I haven't yet. They don't tell you any detail when they give you the MRI. So.
And that's why you had the contrast MRI. Yeah. Because the contrast MRI was when dye is injected into you.
Through an intravenous strip.
So we'll talk about that in a second. But then you saw the pharmacist. So what did you see the pharmacist for?
The pharmacist just wants to find out what medications you're on.
Right.
So if you're on some medications, you've got to either stop that before the operation or just check to see what you're on. So I'm only on one tablet for me liver when I had an issue with my liver about a year ago, which is just like a salt tablet, so it's not a big issue. But
so what up with your liver though? Do you know?
Not really.
What is?
I don't know the technical terms with it.
This is a typical man.
Yeah.
Like, you ask what's wrong with their health. Oh, I'm not sure.
No.
Just taking some tablet.
Well, my liver's pretty good at the moment. All levels are fine
That's
because
good.
of that tablet.
Yeah, okay.
But
yeah.
it was just high levels of something.
Yeah.
And in the liver, you've got small drain ducts in the bottom of your liver. And mine were a little bit blocked. But it was so minor. But if you left it unattended, didn't do nothing about it, over 10, 20, it might be my rest of my life.
Yeah.
They'll slowly get worse. So the tablet that they put me on just keeps it clear, so it's not worse. And last time I went to the Gold Coast Hospital and seen the doctor, she said the readings are fine.
Oh, good.
Because the time before that, I have to say this, I'll get into trouble here, but I didn't have any tablets, so I missed taking the tablets for a little while, thinking, I don't really need these tablets. And the doctor at the hospital said, the reading's up a bit high, that's a bit strange. And she caught me out because she knew I didn't go to the chemist and buy any tablets. So I'm taking the right dose and everything's fine, and I'll just keep on track with that. There's nothing really major with the liver at all. But
So that's a good message, though. You've got to have your health checks. Because even if you feel fine...
I would have never known.
Yeah.
Because it was the same as even the operation that happened on Wednesday.
Yeah.
No symptoms, no nothing. Where a lot of people would have a lot of symptoms, but I got nothing. So
hopefully
that's a good sign.
Yeah, exactly, a good sign. So, feeling really positive, or staying really positive.
Feel fine. And
so the MRI. So I have had an MRI for my back when I had that disc replaced.
Oh, yeah.
Mine was just the MRI. You had, and we all saw in the video yesterday, you had that IV put in.
Yeah.
And so, tell us what happened there.
Oh, yeah. Well, like the MRI, I've never had one before, and it's like, you've even said, a lot of people can get claustrophobic, and they are very noisy.
It's a yucky.
They're thumping and banging, and you think, what's going on? And it takes about 20 minutes.
Yeah.
So I was in there for, actually, when I went in, they give me some earplugs.
Yeah.
And headset and played real nice music.
And what did that do for your shoulder? You said in the video.
Yeah, before I went in, put the drip in.
Yeah.
And they gave me a needle, and that needle, I don't know what it was, but that needle is to stop bowel movement. So in case there's any movement through the system.
because the dye or something does that.
Just the whole MRI, the stiller you are and your whole body, the better image you get. So that needle prevents any movement in your bowel and stuff. So that was the needle, but so they give you headset, nice music. So I laid in there, and I was nearly asleep actually. There's 20 minutes.
I didn't quite go that far.
20 minutes of relaxing, and then with about 3 minutes to go, the music went off for a second, and the nurse or the person operating it said, "We're going to inject the
dye."
Yeah,
it's dye.
Yeah.
What did they call it?
No, they don't call it dye.
Oh.
I'm not sure.
I'm sure there is a better technical term.
But we'll say the dye. They said, we're going to inject that into you now because there's about 3 minutes to go, so you'll feel a bit funny with that. That's all right. And once it started going in the body, straight away I felt really weird. I felt like vomiting. I was just swallowing constantly to keep vomit down. And that I was about ready to push the buzzer to get me out of here because last time I had, it wasn't an MRI, but it was a similar type of thing where they injected iodine into my system, and I had a reaction to that, and got rushed off to emergency pretty quick, and that was pretty scary.
Yeah, you'd be scared about that.
So I was a bit worried once I felt a bit funny yesterday, even though they said it's a different type of stuff, but we'll make sure you're all right. And after about 30 seconds, I was fine, back to normal, couldn't even feel anything for the last 3 minutes, so it was all good in the finish.
So, so you felt nauseous and all that, but could you actually feel it going through your body?
Yeah, tingling in my arms and everything. And that's what I felt when I got the iodine injected in. By the time I come out from the test, my whole body was just a wreck,
Wow.
just shaking and just...
How interesting. I wonder if it's just the solution or if it's reacting with
It's just the solution going through your veins and stuff, I think.
And you can actually feel it, because what I picture is like, you know, in Marvel movies and stuff, how someone will get some spider venom or something and then they show the detail of it going all the way through your veins. You know what I'm talking about, like that image.
And
so that's what the dye's doing.
And it must, because
they're
they're obviously intravenous strips is to get stuff into the system fast.
Yeah.
So, it just goes straight into the system.
Isn't it amazing how quick it happens,
Yeah,
though?
like a few seconds, straight away, I was starting to panic a little bit, but I thought, nah, because I didn't want to destroy the MRI, so I hung on, hoping that it'd go away, and it did. So I could have panicked early, like some people probably would, and press the buzzer, and they would have to drag you out. But no, I survived it.
So you're really controlling, like.
Yeah, I was. I was a bit worried, but I was just because when you're in the MRI, you probably know. Yeah. They have you stretched out with your arms above your head.
Yeah.
And even that for 20 minutes. So
I know.
You got to get out, and you can't even put your arms down. They're all your muscles up.
Yeah.
But in that position, I just held that position and thought, hang in. You won't die in 3 minutes. So, no, it was all good, and they were really nice there. And so that's obviously the results of that get sent away for next week, and we'll see how that goes and see what happens on Wednesday.
So you're booked in on Wednesday, and you don't know what time yet.
No, they ring you on the day before, so you can. They give you a time to start fasting and everything else. And there's a procedure. You got to make sure you have a shower before that evening. I don't know whether you had. They gave me these special sponges in a packet.
Yes.
Where you've got a shower.
Yes, I've had that before.
Yes. Like obviously to make sure the area where they're operating is sterilised.
Yes.
And then you use another one on the morning. And the nurse did say make sure you don't rub it anywhere near your eyes and all that, because it's obviously got stuff in it. So
So basically, in simple terms, they're sanitising your body. They're getting rid of all any bugs or anything on the surface of your skin
before you actually get to the hospital, because obviously they do more there. But they don't want someone turning up and get rid of it.
I know. It's
which I said to her. I've got to say, they were sitting on the table when she was talking to me, and they were in foil like takeaway, and I thought it was her lunch. And she said, "Oh, you've got to take these." It wasn't her lunch. It was mine.
Well, something Gary has to scrub himself with to sanitise himself. That'll probably be the best clean you've ever had.
No doubt it will be.
It'll be squeaky clean. It's actually general anaesthetic what Gary's having. So he's going right under. So you'll have an anaesthetist and you'll be intubated. So you'll have that tube down your throat. So it is a big deal. It is. And he's got to stay in hospital overnight. So
and you stay in because there could be bleeding of the bladder and stuff and everything. And they've obviously got to monitor you overnight. So, and you're not allowed to drive there or home and stuff, which is all normal stuff. But there was a few sort of made me just think about it a little bit more. That it's not just a little operation. Any operation is not a little operation. Any operation, things can go wrong. So that's why I went there today to make sure you go through the whole process. You just don't rock up on the day and she'll be right, like some people do.
So, well, no, it is. It's a big deal, and we've all got your back basically, and we're all very positive and hopeful. It'll be, best case scenario. What I haven't said in the other video we did actually is that there's another chance, because we listed all Gary's symptoms. So he had really low iron before, and that's how this was discovered. His iron levels really dropped. He's got elevated PSA. He's got a small tumour in his bladder area that was only discovered with the investigation. So the doctor who did look at Gary first said, look, it could have been there for years. He's got no cancer cells in his urine, which is a big thing. But that's still no guarantee.
No,
but it's, I mean, obviously it's positive. And that's all, isn't it? Like, I think we've run them.
Yeah.
Oh, and a little bit of blood it was found in your urine as well, but not noticeable.
No, it was microscopic blood. Microscopic. I did 5 urine tests over 5 days. Yeah. And they said there was microscopic.
Microscopic,
blood,
so not obviously pinky streams or anything. Yeah. So very, very minimal, like, no, and you don't feel bad or anything.
No symptoms or anything.
So what we're obviously hoping for is it's just a benign tumour that's been in your bladder for years, and you've just found this out because of all the tests.
Yeah.
And an inflamed prostate can also be a reason for this, which is prostatitis, I think. Because I just said in the first video, an enlarged prostate, which, yes, that can also cause elevated PSA levels. But so can prostatitis. And prostatitis can, or a urinary tract infection as well, is what Gary could also have. And prostatitis, I think, is caused by bacteria and basically an infection. And so if that's the case, you'll be put on antibiotics
to
clear that up. So look, there's, many different hopeful outcomes for this. So we've all got
all thumbs up and all positive.
Fingers crossed, and we'll bring you updates as we go, and we've basically, as people that follow this channel have all said, we've all got your back, and
and thanks for that. Thank you.
And you're going to be just fine.
I'll be fine. Stay positive.